Dr. Tara Narula is a CBS News medical contributor, and she joins us now. Good to see you.
Good to see you, Vlad.
All right, so is there anything in this letter that, what strikes you when you read this?
First of all, it's good to have the information so we don't have to speculate.
Right.
So pneumonia, we know that she had a small right middle lobe pneumonia in the lung that was diagnosed on a CAT scan. And that pneumonia is bacterial, it's non-contagious, and they're treating it with 10 days of a very commonly used antibiotic, levofloxacin, that we use to treat community-acquired pneumonia. And that's pretty much, what we know in general. It's a small pneumonia. The prognosis should be good.
They also disclosed some of the current medications that she's currently taking. They did talk about medications as a blood thinner, and they also said that there was a thyroid medication that she's taking. Tell us a little bit about that.
Right, so they mentioned that she takes B12 Claritin for her seasonal allergies. She takes thyroid replacement medication, and she takes Coumadin, which is a blood thinner, along with the levofloxacin antibiotic. We know that she's had a history of deep venous thrombosis or blood clots in the past, which is why she's on the Coumadin. She also has a history of hypothyroidism. We learned about this in the letter that we saw from July of 2015, for which she takes thyroid replacement therapy. Hypothyroidism is very common in women over 60, and it's not something that's usually dangerous, and usually something that's easily treated with thyroid replacement therapy. And there's lots of different causes for hypothyroidism.
Dr. Narula, you're a cardiologist. What about her cardiovascular and her overall general health?
So what we learned is that she had a cardiac calcium score of 0. And what that means is that people go into a CAT scanner, it scans your heart arteries for any calcification. If there isn't any calcification detected, that means that you are at a very low risk of cardiovascular events like heart attack or death. And that low risk is not just for this year or next year, but usually translates to a low risk for the next 5 or even 10 years. Some research has even shown up to 15 years. So that's very helpful information given that she's an older woman. Her biggest risk is cardiovascular disease.
Anything though, I mean, at least in the report that was released today to the public, anything on here that may cause any concern in regards to the health of the President of the United States that would forbid her from acting out her duties?
I mean, certainly everything in there. She had normal recent blood work. She's had a normal examination with blood pressure, heart rate, oxygen saturation. She's up to date on her vaccinations, up to date on her cancer screening, including a breast mammogram. We know about some of her cardiovascular risk factors, including her cholesterol panel. So, in general, from what we have seen, there would be nothing that you could take away from that as being prohibitive.
I do note, though, Dr. Narula, that in the earlier medical records that she released, her triglycerides were at about 60. Now they're at 159. And I don't know, what does that mean?
Triglycerides, normal is less than 150.
Yeah.
It's a part of the lipid panel, which is a measure of circulating fat in the blood. It's a 159, really not that much higher than the upper limit of normal. Yeah.
Okay.
What about presidential candidate Trump, though, Donald Trump? I mean, he was on Dr. Oz, as we mentioned, and he just happened to have some notes in his pocket that he was able to pull out. Nothing was released publicly, though, but Dr. Oz did mention that he did think that he was overweight.
He's 260 pounds. He's 260 pounds, 6'2", I think, right?
Yeah, so I think conflicting information about the exact weight, but the bottom line is he would be technically considered obese with a body mass index of 30 or above, which would be anything over that kind of 230 weight for his height. So normal body mass index, healthy body mass index is 25 or lower, which would mean he would need to lose about 30 pounds.
And he takes a statin.
He takes a statin. So again, unclear why, what the reasoning is, but certainly.
Well, so, hopefully we're going to learn more about.
Hopefully.
Yes, that should be at least when we see Dr. Oz's show tomorrow.
Right.
All right, Dr. Narula, always good to have you. Thanks for stopping by.
Thank you, Dr. Narula.